Hi, this is Rethik Sir, your biology subject matter expert, and welcome to the biology series again. In the last video, we actually discussed about the mutation. Then, in mutations, there are two kinds of mutations, right? One is Mendelian's disorder and chromosomal disorder. So, we have discussed what is Mendelian disorder, and we have specified that the gene, then what happens if the gene position on the chromosome has been changed, and how can we study through the pedigree analysis or through the family tree, family chart, right? So in this video, we will be discussing or we will be diving into the chromosomal disorder. Like what is chromosomal disorder and what happens if there is any additional or deletion of the chromosome happens, then what it might occurs, like what kind of disorders it might occurs. That is what we are going to concentrate in this video. So moving on to the fact, we know that the chromosomal disorder, on the other hand, they're actually caused by the absence or excess or abnormal arrangement of one or more chromosomes. Like in each and individual organisms, the chromosomal number varies. Like we have a specific number of chromosomes in the human beings, right? 46 chromosomes. So if there is any absence of any one chromosome, or if there is any addition of one chromosome, or if an arrangement is abnormal, okay, so this will leads to what? Chromosomal disorder. So moving to the topic, see there some terminologies comes like one is aneuploidy. So what is aneuploidy? During the cell division, we know that chromosomes, it gets equally separated and equally they gets differentiated, right? During the cell division. So what happens is if there is a failure of segregation of these chromatides during the cell division, so that results into what? A gain or loss of the chromosomes. So we know what are chromatides if you go get into the cell division chapter. So what happens during the segregation of these chromatides, right? Uh, some like homologous chromosomes, mother chromosomes, they get divided into two daughter, sister chromatides, something like that, right? So what happens as a result during the cell division, if there is any abnormalities, this results into gain or loss of chromosome, such as it could leads to Down syndromes. So this is actually result in the gain of extra chromosome 21, that is then it could be Turner syndromes, which is actually a loss of X chromosome in the human female. We'll discuss about this in depth. The next terminology is polyploidy. So it is nothing but a failure of the cytokinesis after the telophase stage of the cell division, resulting in an increase in a whole set of chromosome in an organisms. So this condition is actually seen in some plants. So as I told, all over in a human beings, we have total number of chromosomes in a normal human cell is 46, that is 23 pair of chromosomes. This is how basically a diagrammatical representation of how chromosomes could be written. Out of this, like out of 46, that is 23 pair of chromosomes, 22 are autosomes and 22 pairs are actually what? They are autosomes, and remaining one pair, right? They are actually sex chromosomes. Sex chromosomes are nothing but either it could be XX or XY, depending on the gender. Now, sometimes what happens through at a very rare condition, either an additional copy of a chromosomes may be included in an individual, or an individual may lack one or any other pair of the chromosomes. Like out of 46 chromosomes, sometimes there could be 47 chromosomes, or sometimes there could be 45 or 44 chromosomes. So this is actually called as trisomy or monosomy of a chromosome. Such a situation could lead to a very serious consequences in an individual, such as Down syndromes, Turner syndromes, and Klinefelter's syndromes. So we will study one by one. Coming to the Down syndromes, as the figure itself is representing, it is an abnormal body structure. So this is actually cause of this genetic disorder is actually due to the presence of an additional copy of a chromosome number 21, that is trisomy of 21. This disorder was first described by Langdon Down in 1866. That's why it was named as Down syndrome in the remembering of the scientist. So the affected individual will be having a shorter stated with a small rounded head, then full tongue, a kind of twisted tongue, and partially opened mouth. So his entire facial structure, body structure will be abnormal. Say like his palm is brewed with characteristic palm crisis, and when it comes to his physical appearance and when it comes to its mental status, it is retarded, that is abnormal condition. You can see in this figure like how abnormal the baby is, right? And this is the total number of chromosome set. So what happens in this set of chromosomes? You have been saying there is an additional of one chromosome, right? In 21st out of 23 sets of chromosomes, right? So 20 to 23 pairs of chromosomes, 22 are autosomes, plus one is what? Sex chromosomes, right? So in out of this, in the 21st position, like say this is the first position, second position, third position, in this way, in this 21st position, what is happening? There is an addition of one chromosome. Okay. So because of this, you can see this kind of disorder. Moving to the next disorder, that is Klinefelter syndrome. So this is actually a genetical disorder which is caused due to the presence of additional copy of X chromosome here. So normally sex chromosome, either it will be X and X or X and Y. So what happens? Instead of 46 chromosome, an additional chromosome will add, that is 47 chromosomes, but where? In the X chromosome. Okay. So sex chromosome, an additional copy of X chromosomes will be added. So resulting, what would be the karyotype? The total number of count of chromosome will be 47 because in sex chromosome, there will be XXY or XXX. So such an individual, especially it is seen more in the male, what happens here is an individual who has the syndromes, right? So he will be having overall muscular development will be retarded. Then the person will be he'll be having the physical appearance will be feminine kind of development. So you can see here the development of breast and no proper male muscular development can be observed. Such an individual is sterile, like he cannot produce the sperm or offspring. The last syndrome in your textbook is Turner syndromes. So Turner syndromes is actually seen in the female more. So what happens? So this disorder is actually caused due to the absence of X chromosome here. So in the two syndromes we have discussed there is presence of one chromosome, but here there is an absence of one chromosome, that is X chromosome. Total how much will be the karyotype name? Like how many chromosomes will be there? 45 chromosomes will be there. So that means that too in a sex chromosome, I told like one of the X is absent. That means X and O, right? So as a result, what happens? Such the female, they are obviously they will be sterile. They will be unable to produce this. Their ovulations are rudimentary, beside other futures, including lack of other secondary sexual character, like the female development, menstrual cycle. Everything has been retarded. Like you cannot see such development in the female. And here you go. And this is how it actually looks. So you can see here, out of like 22, 23rd position, where we normally indicates it as a sex chromosome. So one of the X chromosome is absent. So because of which it leads to what? Turner syndromes. And this was all about a chromosomal disorder. A very simple thing. The only thing that we need to remember here is, so what kind of disease and what happens and which chromosome at which position because of its absence or addition or deletion, what kind of disorder is caused and its symptoms. It's a very simple thing. If you remember this, any question on this topic will be able to crack. And don't forget that 50 questions per day challenge. Try to make up the challenge, and if you feel a difficulty finding more number of MCQs, you can prefer the MemoNeet, where you have more than 1,000, 15,000 MCQs based on the topic. And all the best.